This is my audience. This is my visual aid. This is my PowerPoint presentation. My specific purpose is to inform my audience about what LASIK eye surgery is, the risks of getting it done, and the procedures before, during, and after the surgery. When the word LASIK is mentioned, some people may know it, some people may never have heard of it. The ones that may know it are going to be the people that may have bad vision. LASIK eye surgery is a procedure done on eyes to help better vision. According to the U.S. Department of Health and Human Services, the cornea is a part of the eye that helps focus light to create an image on the retina. It is like a camera lens that focuses in on the light to make an image on film. The bending and focusing of the light is also known as refraction. There are three primary types of refraction errors. There are myopia, hyperopia, and astigmatism. Myopia is also referred to as nearsightedness. This is when a person cannot see well far away as they can up close. Hyperopia is also called farsightedness, which means you cannot see as well up close as you can far away. Astigmatism is a distortion of the image on the retina caused by irregularities in the cornea of the lens of the eye. There may be situations where you could have one or more refractive errors. This is common among many people. People wear contact lenses or glasses to try and compensate for the imperfections on their eyes. The U.S. Department of Health and Human Services said that LASIK surgery is precise and controlled removal of corneal tissue by a special laser that replaces the cornea, changing its focusing power. According to the Lasik Vision Institute, LASIK is one of the most common eye surgery procedures performed. This procedure is said to be quick, simple, and affordable with amazing results also. Sometimes the surgery may not be for everyone. If you are not a risk taker, if it is or will jeopardize your career, or if you have money issues. If you have required a change in your contact lenses or glasses within the past year, you may also not be a good candidate. You may be refractive and stable if you are in your early 20s or younger. If your hormones are fluctuating due to diseases like diabetes, if you are pregnant or breastfeeding, or are taking medication that cause fluctuations in your vision. There are quite a few conditions or risks that you may have that could prevent you from being able to undergo the LASIK eye surgery. Here are a couple: large pupils, thin corneas, and dry eyes. With these conditions, you could eventually get the surgery done. However, you may have starbursts, glares, or double vision after the surgery. LASIK eye surgery may cause some patients to lose vision. Some may be overtreated or undertreated. There are only a certain percentage that result in 20/20 vision. As you age, your LASIK eye surgery results may also diminish. After you consider all the risks, if you still want to undergo the surgery, there are some things you may need to do. Prior to the surgery, you will need to contact your eye doctor and get a baseline evaluation. This is to determine if you are a good candidate for the surgery or not. If you wear contact lenses, you should switch to glasses immediately. contact lenses change the shape of your cornea for several weeks after you stop wearing them. If you wear soft lenses, they should be taken out 2 weeks prior to the evaluation. If you wear hard lenses, they should be taken out 4 weeks prior to the evaluation. Or if you wear topic soft lenses or rigid gas permeable lenses, they should be taken out 3 weeks prior to the evaluation. Your medical history needs to be discussed to make sure you are a good candidate also. There comes the day before the surgery. You should not wear perfumes, creams, lotions, or any makeup prior to this. Arrangements for transportation should be made because of your vision may be impaired or blurry. According to Liz Surge and the U.S. Department of Health and Human Services, the day of the surgery, the doctor will either use a microkeratome or a lid speculum. If this microkeratome is used, then a numbing drop will be placed in your eye to affect your eye and the surrounding area. A ring will then be placed on your eye to suction the cornea, and then the microkeratome will be placed on top of it, which will be the cutting tool that will cut the flap of your cornea. If a laser keratome is used, the cornea will be flattened with a clear plastic plate. Laser energy is focused inside the cornea tissue, creating thousands of small bubbles of gas and water that expand and connect to separate the tissue underneath the cornea surface, creating a flap. The plate is then removed. Then a laser will be positioned over your eye, and you will have to stare at it for at least 60 seconds. If you cannot remain staring at this light for 60 seconds, then you will not be a good candidate to get the LASIK eye surgery done. The doctor knows exactly how much tissue to remove from your retina by the initial evaluation you undergo. After the procedure, a shield is placed on your eye. Since stitches are not used, this shield is to ensure the flap stays in place. The shield is to prevent you from rubbing your eye and from accidents like getting poked in the eye or sleeping and it moving. After the surgery, your eye may burn, itch, or feel uncomfortable. Sensitivity to light, glares, or spots may occur, and if you have severe pain, you should contact your physician immediately. Visits with your doctor should be regular, with up to 6 months after the surgery. LASIK eye surgery is the most common performed refractive surgery according to Liz Surge. LASIK is so popular because it has advantages over other procedures, like relative lack of pain afterwards, and that good vision is usually achieved by the next day. Although the procedure takes some time to prepare, many say it's well worth it. The baseline evaluation is what determines if you're a good candidate. The preparation makes sure that the surgery goes well, and the cautions afterward try to ensure no infection and good eyesight.